on combating erythroblastosis fetalis, a neonatal success story, an insight into the diagnosis, management, and prevention of hemolytic disease of the newborn. Introduction. Erythroblastosis fetalis is a hematologic disorder in neonates, resulting from the incompatibility between the blood types of the mother and the fetus. It is also known as hemolytic disease of the newborn, HDN. This condition primarily arises when the mother is Rh negative and the fetus is Rh positive, leading to the production of maternal antibodies against the Rh antigen on fetal red blood cells. It can also occur due to ABO incompatibility, but is less severe in those cases. Sample case study. Background information. Patient, female newborn. Maternal blood type, ORH negative. Paternal blood type, ARH positive. Fetal blood type, ARH positive, inferred. Clinical presentation. The newborn presented with jaundice within the first 24 hours of life. Physical examination revealed hepatosplenomegaly. Laboratory tests indicated anemia and an elevated respiratory count. Diagnostic tests. Direct Coombs test was positive, indicating that the newborn's red blood cells were coated with maternal antibodies. Blood type testing confirmed that the newborn was ARH positive. Hemoglobin level, found to be low, consistent with hemolytic anemia. Bilirubin levels, significantly elevated, indicative of hemolysis. Answer explanation. Pathophysiology. In this case, the mother's immune system has recognized the Rh positive fetal red blood cells as foreign due to her Rh negative status. This recognition led to the production of IgG antibodies against the Rh antigen. These antibodies can cross the placenta and target the fetal red blood cells for destruction, leading to hemolysis. Clinical presentation and diagnosis. The newborn's jaundice and anemia are direct results of this hemolysis. Jaundice occurs due to the high levels of bilirubin produced from the breakdown of red blood cells. The positive direct Coombs test confirms that the hemolysis is immune-mediated, as it detects antibodies or complement bound to the surface of red blood cells. Management and treatment. Phototherapy, to reduce the bilirubin level in the newborn's blood. Blood transfusions may be necessary to manage severe anemia. Intravenous immunoglobulin, IVIG. This treatment can reduce the need for exchange transfusion by blocking the Fc receptors on macrophages, thus decreasing hemolysis. Prevention. For future pregnancies, Rh-negative mothers should receive Rh immunoglobulin, RHIG, during pregnancy and after delivery if the baby is Rh positive. This prevents the formation of antibodies against Rh positive blood. Conclusion. Erythroblastosis fetalis is a preventable and treatable condition. Early detection of maternal and fetal blood types and appropriate intervention during pregnancy and after birth can significantly reduce the risk and severity of this condition. Medical lab technologists play a crucial role in diagnosing and monitoring these cases through blood tests and ensuring accurate blood typing and antibody screening.